Welcome back to another OAO Member Spotlight, and today I will be talking to none other than myself. And before you click on to another video, please afford me the honor of a few minutes of your time. This is my last episode, a bittersweet episode. At the end of October, I will have been your OAO president for 2 years. When I took on this role, I don't think I quite understood how busy it would be, and my first reaction was I don't know if I can survive my full term. But here we are, at the end, and when I look back, I'm amazed at what we've been able to accomplish. And when I say we, I mean the staff at the OAO office, the executive team, and your board of directors, and the dozens and dozens of volunteers that make up our committees. This truly is a team effort. And I would just like to take a few minutes to highlight some of the great work that has been done over the past 2 years. Just a few months into my term, if you recall, we released a white paper entitled Optimizing Optometry's Role in Ontario. This was a year-long effort that began under the presidency of Dr. Farouk Khan and had the input of over 70 optometrists, thought leaders from across Ontario. Why did we do this? Well, government challenged us to come to them with a different strategy, a strategy that simply did not ask for more money. We knew we had a great story to tell. All we had to do was gather the data, bring together the experts, and show it to government. Why were we so confident? Well, we see it every day in our practices. Patients are consistently amazed with the level of care they receive when they go to an optometrist. No other profession or group knows as much in the eye health and vision care space as we do. I'm sure all of you hear patients say on a weekly or even a daily basis, I should have come here first. The white paper is an aspirational document. There are dozens and dozens of recommendations in it. Not all of them will come to fruition, but what it has done is change the level of conversation that we are currently having with decision makers. They see us as a valued stakeholder in decisions around eye health and vision care. Since the white paper was released, we have had 5 high-level meetings with the Ministry of Health and Long-Term Care. The last 2 have been specifically around revising the schedule of benefits. And I'm sincere when I say that government sees us as a partner in shaping the delivery of primary vision care in the province. Change is on the horizon. Will we get everything that we want? Probably not, but I am confident that the changes we will make will be much better than the status quo we have all been living with for far too long. I would like to take another minute or two to go over some of the other things we have done on your behalf over the past 2 years. We custom designed a professional liability insurance policy. We took a stock policy from a major insurer, took it apart piece by piece, built it back up into what is probably the most comprehensive PLI package for optometrists anywhere in the country. With regards to suppliers and internet dispensing, we took a principled stand, one that caused waves across the industry, but one that your board felt was very important to take. We transitioned our paper drug guide into an online version called the OAO TPA app. In our recent member survey, it was one of the highest rated member benefits. The TPA app is constantly being updated as products and formulations change. Probably the most exciting piece is we have licensed the code to all 10 provinces across Canada. The revenue we receive from this partnership will be put back into the app to make it even better. OAO has also partnered with Sick Kids Hospital and McMaster University on a pilot project around children's vision. That partnership is now entering its 2nd year and has caught the eye of healthcare decision makers. As far as public education and marketing, in 2015 our marketing campaign entitled 20-Second Daydreams won Best PR Campaign of the Year as selected by the Canadian Public Relations Society. The list goes on and on and on. But upon reflection, probably the biggest change that I've witnessed is something that is somewhat intangible, but without a doubt is extremely important. Trust me when I say that OAO has become the authority in the primary eye care space. Our level of professionalism as an organization and influence have increased substantially. Government, industry, and stakeholders now look to us as the expert and trusted partner. We have now earned a seat at the table when decisions affecting eye care in this province are made. We have turned from a group that too often was reactive to one that more and more takes on a proactive role. This sea change would not have been possible without the hard work and support of the team at OAO. Our executive director, Beth Whitney, has pulled together a great group of skilled and hardworking people. I would also like to thank Dr. Jeffrey Guthrie, your vice president. I could not have asked for a better wingman, and I think we complemented each other very well. I must also personally thank your board of directors. They are a group of passionate and intelligent optometrists. They have devoted significant time and energy, even with some conference calls going into the wee hours of the morning. They've worked through some very difficult files, and every decision that they make is through the lens of what is best for our members. And that is something that no one has lost sight of. Last but not least, I would be remiss if I did not thank my spouse, Dr. Tina Goodhew. They say that behind every man is a great woman, and that was certainly the case here. Without her support, I would not have been able to devote the time and energy that this role demands. As a profession, our goals are ambitious, but if we all work hard together, we can accomplish great things. So to finish off, thanks for the opportunity. It has been an honor to serve you and the profession. Thank you.